I'm Jantina McMurray, a third-year vet student at UCBM. We are here at Bar None Ranches, and we're going to learn about a hyperbaric oxygen chamber.
What is hyperbaric oxygen therapy?
Hyperbaric oxygen therapy, HBOT, is a high-dose oxygen inhalation treatment that is achieved by having the patient breathe 100% oxygen inside a pressurized hyperbaric chamber. thehorse.com.
The hyperbaric chamber is pure oxygen in a pressurized environment, and the pressurized environment allows the bloodstream to carry a lot more oxygen than normal. Pretty much anybody that has performance animals around and are needing to rehab injuries or just help with overall performance. They've regulated how often you can use the hyperbaric chamber and when you can use the hyperbaric chamber in regards to racing, because it's believed to be performance enhancing in the racing world. So we're actually we're restricted in the amount of time that we can use the hyperbaric. We have to control the environment quite a bit. Horses are not allowed to have any liniments or oils or anything like that in their skins, in their manes, tails. They can't wear shoes in the chamber. We monitor the humidity levels in the chamber as well as around the barn for static electricity sparks. We soak down the chamber and the horse before they go into the chamber. And I've got some different settings as far as the atmospheres that we can put them, the pressure that we can put them under. But generally it's about 2 hours. You can treat a horse in the hyperbaric chamber for 5 days consecutive, and after that point you can start alternating the days. So if they're in for 10 sessions, 5 sessions all at once, and then 1 every other day after that. This chamber is capable of holding 2 horses. They stand head to tail, and so the first one loads in, the partition closes, the second one loads in, the second partition closes. We remove the ramp, close the door, and then we can activate the seal, which essentially maintains the pressure vessel. And at that point we activate the oxygen, and it starts in liquid form and it vaporizes and it starts pressurizing the chamber. This is the main control panel of the hyperbaric chamber. We've got the monitor, which is attached to the 2 different cameras that are in there. We've got temperature and humidity sensors on it. We try to keep track of the levels of humidity while they're in there. This is cycles gauge. It tells us how many times the chamber has been used. Literally just turn the dial to the time that we want, and it just does its own thing.
What is a hyperbaric oxygen chamber, and how does it work?
The hyperbaric oxygen chamber is like a big cylinder that you close and seal, and you can then increase the pressure of gas into the chamber, and the gas we use in this case is pure oxygen. So the horses are in the chamber, and then we increase the pressure of pure oxygen, and all they breathe is pure oxygen. Typically we use 3 ATA, so 3 times absolute atmospheric pressure, the equivalent of 760 millimeters of mercury times 3 in terms of absolute pressure.
What are the indications for using hyperbaric oxygen therapy in horses?
It's mainly infectious problems. So if you have infections, abscesses, for example, you're going to try to put more oxygen into these infection sites so that the bacteria are killed more easily and your immune cells are more active. Horses with skin grafts or tendon grafts and things like that also. There is only 3 papers basically covering the usage and of hyperbaric oxygen therapy in horses, and so that's where we started, and that's why we wanted to start with the basics for this research project and see if first of all, having a horse inhale and breathe pure oxygen at a high pressure is first of all bad or not for the lungs.
What's the physiologic effect on horses of being in the chamber breathing pressurized oxygen?
Well, when horses breathe at normal ambient pressure, air pressure at sea level, they have a saturation of oxygen in their blood of 97%, which means that the red blood cells carry lots of oxygen, almost all of the oxygen that is carried by the blood at sea level is carried by the red blood cells circulating into the blood. People are using hyperbaric chamber to increase the amount of oxygen that is transported into the blood by the blood into the tissues. So when you use pure oxygen and you increase the pressure of oxygen, then not only you have a complete saturation, so your red blood cells carry all the oxygen they can carry, plus on top of it, you are dissolving some oxygen in the fluid around the red blood cells, if you want, in the blood. We found that the oxygen therapy, hyperbaric oxygen therapy, doesn't seem to be bad for the lungs. We didn't see any increase in inflammatory cells. We didn't see any increase in inflammatory cytokines, so proteins that are secreted by the immune system or the cells when they have to fight an infection or trigger an inflammation. So the genes were actually very quiet. There was no expression of pro-inflammatory genes. And we even found, interestingly, that it actually does seem to have a mild anti-inflammatory effect on the lungs of these horses, because the cell count, like the number of inflammatory cells within the lungs seem to decrease with the treatment.
Okay, so with the results of the study, would you be recommending more horse clients be using the treatment? Or?
Well, again, that's we used it only for one specific type of problem. We focus really on lung inflammation, lung problems, right? We use horses with normal lungs, and so I wanted to start with the basics, like you take a normal horse, put him in hyperbaric oxygen chamber, what happens to these lungs? What we found, yeah, it seems good. No inflammation, doesn't induce inflammation. If anything, may even reduce the number of inflammatory cells in the lungs, so that's all good. We found it's also a short-term effect for oxygenation. So now I think the next step is to actually try some horses with a disease and see if it works to help them. And with my field of research, of course, I would like to use some horses with lung inflammation, put them in these chambers and see if we can decrease, cure, or resolve the lung inflammation just with the hyperbaric oxygen therapy. Once I have that, yes, then I would recommend it. For now, all I can say, it doesn't hurt. So yes, if you feel you may help your horse, at least I can say it doesn't hurt for the lungs, so why not? Now the evidence is again quite limited for the applications of it in equine medicine, but these results are definitely encouraging, yes.